autoimmune hepatitis. So as a baby, she had a split liver transplant. So they give like the left lateral sector to the baby, and then they give the extended right portion to an adult. So this is her now 20 years later. She has this big left portal vein, and she also had biliary dilation, basically from a stricture near the hepatico-jejunostomy over here. So they asked IR to go and put a PTC in and basically do a benign stricture protocol where they dilate the stricture up over repeated scans. So the next scan, there's a PTC catheter in, but now there's a portal venous thrombus. So this is one of the known complications of PTC. So a couple of things that can happen is if they stick too centrally and they accidentally hit the portal vein, that can cause this portal venous thrombus. And the other thing is, in this case, they actually saw that they stuck pretty far peripherally, but when they went into this area, when they dilated up the bile duct, they're basically right next to the portal vein, and so they think that's how they injured it. So this is kind of like a known complication that happens sometimes with PTCs. Because of this portal venous thrombus actually started getting bigger by the next scan. If it had completely spread throughout her liver, she would no longer be a transplant candidate. So they needed to, and they couldn't anticoagulate her because she has all these varices that have bled in the past. So they basically had to do a TIPS procedure on her. And the interesting part of the TIPS was that because she had this abnormal anatomy and such an acute angle, they had to do a transplenic approach to get into the portal vein. So they went through the spleen, through the splenic vein, into the portal vein, and they were able to like kind of lasso it up, but that's why it kind of takes this like curled configuration here. But anyways, and then by her next scan, this is what she looked like. So her portal venous thrombus is getting better, and her TIPS is there and it's pretty patent. And then the other interesting kind of thing is that she has these little plugs in her spleen. So this is a sign that they've used a transplenic approach, and they've put an Amplatz plug to seal up their hole as they leave the spleen.
Oh, wow.
So they actually had to access the spleen twice. So they put 2 big Amplatz plugs in. But the first time I saw this, I wasn't aware that they were like going through the spleen to do these things. So they said they do that whenever there's like a really weird angle on the portal vein, or they just can't get to it through the normal route. So
It's incredible.
okay, those are my cases.